So just to talk a little bit more about our guest alum today, Mr. Adam Gobin was born in Trinidad and Tobago and attended high school in Mexico City. He graduated from the University of Georgia with a double major in biology and Spanish in 2006. He then pursued a master's in public health and PhD degree at the University of Georgia and graduated in 2008. Adam joined the Emory's Clinic Management Development Program, MPD, after getting his MPH and spent 7 years in leadership roles in the Emory Clinic Patient Financial Services Department. He then joined WellStar Health System in January 2020 as the Assistant Vice President of WellStar's Medical Group Business Office. Mr. Gobin, if you wouldn't mind expanding on this and sharing your UGA experience, what you're currently doing now, and how UGA, Franklin College, and the College of Public Health was impactful on your career.
Sure. Thanks, Tiffany. Appreciate the time. I can't tell you guys how excited I am to be here. Speaking with you all, fellow Bulldogs, is a little intimidating, to be honest, because it means that I am really old. I'm sure none of you are less than 22 years old, so everybody looks so young. So I'm really excited because I have a few experiences that I kind of jotted down today that I thought about, and one of my very good friends, Luke Massey, could kind of speak to some of this stuff too. So the first experience that shaped my UGA stint and then also my career was my first stint at O House Dining Hall as a staff member. Keep in mind, I never had a job prior to UGA. I just saw signs saying, we're hiring, and maybe I wanted to be like Miss Sandra, I don't know, but I really liked the idea of having a job, gaining some responsibility. So I was put to wash dishes, and I washed the heck out of those dishes. And it was fun. I got to really socialize with a lot of people and make friends there in the dining hall, see classmates and things like that. So I felt pretty accomplished, but I also felt like I still had a lot of time. Any sort of 15-minute increment or 30-minute increment of nothing made me feel like I needed to do something else. So I joined the Caribbean Students Association because I'm from Trinidad, and I'm pretty structured. So I'm not like a normal Caribbean person. I'm very structured, organized. So when I went to the first meeting, I realized that they didn't have an agenda, which kind of freaked me out. I was like, what are we talking about? And what are the topics and things like that? So I decided to volunteer and help out a lot with the communication strategy, coming up with agendas, newsletters, just the whole communication thing. I then became the president of the Caribbean Students Association that next year, and then served for another couple of years. And it really helped me sort of understand as in that role how to really lead an organization, which is huge because you've got to be great at relationship management. You've got to learn it. You've got to be in essence political. I remember making a lot of friends with the African Student Union folks so that I can gain just leverage the best practices that they were doing and things like that. So really taught me politics and relationship management, which was really good. Managing a budget too. I wanted more, so I decided to apply to be an RA, resident assistant. And so I was really honored to get the role at O House because I lived at Oglethorpe House. So I was an RA there for about 3 years. And I was always the runner-up for RA of the year. I was always behind UGA's Prince Aladdin, Raj Shah, who, by the way, is one of my best friends till this day, and we live just a few miles away from each other. But being an RA was incredible. I learned what the smell of weed was like. I'm from the Caribbean, so I clearly wasn't a good testament to my ancestors. I had a lot of conflicts, including people smoking weed and things like that that I had to deal with, as well as just relationships, right? I had to get into conflicts to help resolve them, to get out of the conflicts and things like that. So relationship management as a residence hall assistant is a really big deal. It really helps to sort of train you from a relationship management perspective. One of my RA colleagues nominated me for orientation leader, which is where Luke Massey and I became friends. And I immediately turned it down when I went to the info session and saw Raj Shah there. I was like, nope, I am not running against this guy again. Not worth it. And then I realized he was just there because one of his friends was there. And so I immediately submitted my application, and I was so happy to get chosen as the orientation leader number 12, which I dubbed the Tropical 12s back in the day. and I actually saw somebody on Howell Mill, where I live close by in West Midtown, in the pet store there. And they screamed, "Tropical 12s, there's my OL." And in retrospect, and he had his little daughter with him too. And in retrospect, I should have chosen a different team name, because hearing that screamed at you in public 12 years later is kind of different. But being an OL gave me a lot of stage time. I had the ability to act, sing, be creative, all not good, but still gave me confidence to be able to do all those things. I also had alone time with each of my groups every single day. So that really forced engagement. And I learned the ability to handle situations where, for example, people that obviously and visually are not enjoying themselves or not enjoying the moment, how do you spark interest in them? And even if it's just to get them to speak and things like that, it was a big deal. So, learning all that stuff was really good. Thinking back on my OL experience, was definitely one of the best. A lot of discipline is required. Late nights, very early mornings. You're constantly on a high because you're just doing a whole bunch of stuff every single minute of the day, and you're going to bed at like 2 a.m. You're always on. You're smiling. You're in some cases faking your happiness, and you're having to get the job done while making people happy, and that teaches you a lot in life and later on in your career. It's a really great experience. So being an OL was fantastic. I then got nominated by the Caribbean Students Association for Homecoming King. And guess who's back? Raj Shah is also on homecoming court. So he's just, always there, that guy. This time, however, I was able to win it. And so every time I go visit Raj and his family, I always wear the crown that makes you look like a Smurf a little bit. They actually modernized the crown, but just quick update, Raj doesn't care. So anyway, that's sort of the social aspect of what I enjoyed at UGA. And by the way, that was a massive part of what has helped me in my career development since I left UGA. The social aspects, joining clubs, being a part of organizations, leading clubs, anything, volunteering, all of that stuff has really shaped who I am, how I interact, and things like that. I went to Georgia Tech for my MBA. I know it's a huge taboo thing. And when I did my MBA there, while I was working at Emory Healthcare, which I'll talk about shortly, I engaged a lot with the Georgia Tech people and realized even more importantly why UGA was so important, and why I'm glad my undergrad and my first grad was at UGA. And that's because UGA allows the ability, it's a liberal arts focus, but it allows the ability for you to actually focus on your relationship management, period. It's a great school for that. Georgia Tech, a lot of the people, and I am generalizing a little bit, but a lot of the people in the MBA program that graduated from Georgia Tech didn't have that personal experience, and personnel experience and relationship management. And when you interview and when you go to organizations and you see people face to face, even if it's virtually, you have to make that connection. So regardless of where you got your degree, what your degree's in, the relationship management piece is why you get selected. Connections is why you get selected. All those different things, it's all related to relationship management. Franklin was fantastic, and so was the College of Public Health. They both, from an advisor perspective, I utilized all of the advisors that I could while I was in Franklin and then in my grad program at MPH. And they were all focused on me, my development. And just so you guys know, my advisor at Franklin was actually the one that helped me pivot my career. I always thought that I wanted to be a doctor. And I did a medical Spanish study abroad in Peru, and my entire capstone project was on the operations of the hospital. So it was like, here's where they could be better, here's where they could be saving money, those types of things. And my my professor was like, where's the clinical part of what you learned from this medical Spanish study abroad? And I told him, I was like, oh, I think I prefer, the operations, how they could improve. And my Franklin advisor was the one that said, you might want to get into healthcare administration. And I had no clue what that meant. I had no clue what healthcare administration meant. I just knew what being a doctor meant and that they make money. And so healthcare administration, I thought, was just some, random job. I looked it up. I still wasn't 100% into it, but my Franklin advisor urged me to go do an internship at Athens Regional. That was really, really helpful. It made me want to then sign up for the MPH program. The College of Public Health was just being born at the time. It was absolutely fantastic timing. And so I joined there, and that's where I met Heather McEachin over here. So I'm so glad I joined. and had a fantastic time in the College of Public Health. I was also a part of the, I led the student group there. That was really exciting. I was able to be a graduation speaker, which was really exciting too. But through that experience, because the professors there were so connected, again, it goes back to connections, I was able to get a fantastic internship with James Shrum in Athens Regional. He's a nurse leader there in administration, and I really learned a lot about clinical operations, how my role would fit in not being clinical. It was really, really cool, and that helped to propel me in my career, that experience. So one piece of advice, and I'll give advice and tidbits as I go along, I'm not waiting till the end, is that you do make connections and try to get out there because you need experience. You don't wait till the end of your program to get experience and then go apply for a job. While you're in school, go do it. And while you're doing things, go explore and go learn, because that's the experience that you need to be able to speak about with people. So that was really key, having that experience. I was able to speak to the Athens regional leadership there and what I learned and all that kind of stuff. And it was tangible when I was signing up for my internship at Emory. Finally, the reason why I do remember my College of Public Health degree is because my last spring there, right before I graduated, I went on a Royal Caribbean cruise. And that is where I met the daughter of the chief of operations of Emory Healthcare. She also went to Georgia, Stephanie. She's fantastic. And she connected me with her dad. He drove down from Emory Healthcare and had coffee with me. I forget what that main road is. I don't even know if it was a Starbucks, probably a Jittery Joe's or something. And just had coffee with me and offered me an internship at Emory Healthcare. And so right when I graduated at the College of Public Health, I then joined the Emory Clinic's internship program. And that was in May 2008. I really had a great time there. Again, relationship management. Got to leverage my skills in relationship management to build a lot of friendships and professional relationships with who would then become my leader. He really loved my work. I worked my tail off as an intern, and he offered me a job in the management development program at Emory, which still exists. I participate in the mentorship program for UGA, and are speaking to my mentors about that very thing. So Emory Healthcare has a lot of great opportunity for growth and development for budding folks like you guys if you're interested in healthcare administration. So I joined the management development program, which put me in managerial positions at a very early age. Early for me, you guys probably still think it's Medicare age. It was around 23 or 24 that I became a manager, which was really exciting. I got to manage people, and it taught me humility and really made me think managing someone doesn't necessarily mean you have to boss them around. And I don't think I ever thought that, because I have always been in a situation where I was never a leader, but I learned from leaders that never boss people around. So that was a great thing that I learned that helped me in my career. So being an early manager was great, but also taught me a lot. I failed a lot as a manager. I worked my tail off till sometimes 3 a.m. every day, realized how important sleep was, which is why I sound like this now. Clearly I haven't learned because I was up late last night. But definitely worked very hard in that management development program at Emory, but again, trying to feed into my ADHD of never being satisfied with things. I did my MBA at Georgia Tech while I was at Emory. Really strained me. I was doing a lot of work. Georgia Tech's MBA's program is very rigid, and that plus a full-time job and leading, at this point I was the director of revenue management, so leading 170 people. It was a lot. I was incredibly stressed. I had a lot of heart-to-hearts with my boss at the time because I was just on edge. So I had to really control my temper and my organization and things like that. So that was I would call it a failure. I never failed in my job, but in terms of multitasking and in terms of taking on too much, those were the things that I really learned. I needed to become a better delegator. So that was one major thing I learned while at Emory. I then wanted a change of scenery. I learned a lot at Georgia Tech, got my MBA in technology with a focus in technology. And so I joined Athena Health, which is a healthcare information technology company that's focused on EMR and practice management systems. And I really loved Athena. I got to travel. I got free daycare for my dogs that might be lingering around in the background if you see them. But it was a great life. I was an individual contributor. I didn't have any staff. And to be honest, after having staff for 8 years at Emory, I was just so happy to be an individual contributor, making great technology happen at Athena. And I loved it. I was a senior solution design manager. I got to meet a ton of clients. I got to go out to a lot of health systems, meet their C-suites, and really understand their book of business and why they were looking at Athena. So I learned a lot about why health systems either failed, were failing, or were looking to improve, and all those types of things, which was really, really neat, great experience. 3 years into Athena, I felt the itch of, I miss managing people. I miss being a leader. I miss mentoring, which is why I got into UGA's mentor program and all that stuff. I just missed being around people and leading and having a sense of accountability in a sense. So I wasn't looking for a job. I'll tell you, my work-life balance at Athena was fantastic. I don't know if you guys heard of Fetch Dog Park in Atlanta, but Fetch Dog Park's fantastic. And I would be there like every day taking calls. It was the best life. So I certainly wasn't looking for a job, but a recruiter contacted me about WellStar in my current position. And I said, what the heck? It's a great job that has a lot of oversight over a ton of people and great responsibility. And I think I want that. I want to go back to that because I had that at Emory Healthcare. And this is a much bigger role than I was at Emory. So I applied and I got the job and I started in January, and then COVID hit in March. So I had to quickly pivot into a whole new leadership style, now virtually. How do you engage over 200 people, an executive director, multiple directors, ton of managers? How do you engage all these people, make them feel like you're trying to help them progress in their career, progress in their jobs, and things like that? It was a huge challenge. But I've learned a lot since the experiences that I've mentioned at UGA, and all the conflict management and all that kind of stuff. And then through my experience in a lot of failures as a manager at Emory, as a budding manager, and learning a lot of things and failing in a lot of things, I just learned a lot. And so I was really able to kind of pick up and figure things out. And we ended up at the end of the year with the largest book of business in terms of payments and revenues, net revenues that we booked in our income statement. And that's including the pandemic and excluding any kind of HHS funding. So it ended up being an incredible year for WellStar and for my team. And the engagement level, our Great Place to Work survey that went out was typically, before I got to WellStar and joined this team, was in the 60s, and we ended up at 88. Very close to 90, but we'd never even crossed 80 in the history of the department. So the fact that the staff were essentially reduced, their hours were reduced by 8 hours per week, which is a big deal for frontline employees if you're a frontline employee. And my directors and executive directors needed to take a cut, as did I. It was a tough time, but taking into consideration a massive pandemic, reduction in your pay during the time, and still rating your work-life balance and satisfaction close to 90, where it's never even been close to 80 in the past, was really huge. So I owe all of it to my experiences and my life at UGA. And I know that's true because I still connect with my my friends at the College of Public Health via volunteering and donations and things like that. And I also do the mentorship program at UGA, and I'm wanting to do more. And I just like this as an example, because I owe UGA as much time as I can have, because they're the ones that helped to propel me in my career. So I did kind of talk fast. It's 4:20. I think that's kind of where my stopping point is, but I'm happy to answer questions or elaborate on anything if there's any questions. And hopefully I wasn't talking on mute the whole time. That would suck.
So what do you think it was about you that made your friend's dad want to drive all the way here and meet with you about an internship?
It's a good question. I think that that's a really good question. I never actually questioned that. I should have really thanked him, now that I think about that.
That's like a big deal.
It's a big deal. He did drive an hour and a half, and he's a chief of operations. I think I even showed up with a UGA hat on. That's how like inappropriate I was back in the day. And probably actually Luke will tell you still nothing's changed. But honestly, I would say it goes back to the relationship management piece. I met Stephanie on the cruise. We had a lot of mutual friends. And Stephanie knew or heard about all the things that I did at UGA, like orientation leader, RA, all those different things. So I know she told her dad, Don, that, because he certainly brought that up in the conversation. So I think it has a lot to do with, again, the relationship management piece. You have to be able to sell yourself and not look or sound like a salesperson. You've got to be very natural and genuine. And that will make somebody drive an hour and a half on 316, and Lord knows nobody wants to do that. So I really do think it has to do with that piece. But at the same time, I'll tell you, Don Brunn, who was the chief of operations at the time, is not only all about relationship management, but he was all about bench strength. So if he heard of an ability to bring on a freshman player to help, who could eventually become a great leader at some point, and heard from his daughter that this guy seems credible, I would make that drive if I feel like I can grow and develop my department. One thing he always woke up every morning thinking was about development. How can I keep growing and developing people so anytime there's an opening, I can just fill slots? And that's why he actually single-handedly created the management development program, which I joined. So it was definitely half and half. He was seeing an opportunity for himself and for the company. So yeah.
We had a question in the chat from Tiffany. It's a really good one. She's asking, what do you suggest for somebody who's taken on too much and is already locked into commitments? You talked a little bit earlier about feeling overwhelmed. So if you could just kind of go into maybe specific methods you took on to cope and manage that stress, that'd be awesome.
Yeah, that's a really good question. That actually hits me really deep, because that's why I left being a resident assistant and went to go live with, I point at Luke, I don't even know if that's where he is in the little square thing. But I left being a resident assistant because it got overwhelming and I was doing so much. I was an orientation leader. I was doing a ton of classes, trying to make sure I graduated on time. And you guys know pre-med classes, it's incredibly tough. I was also in a whole bunch of organizations and things like that. In retrospect, because I didn't fix that habit at all. In retrospect, what I've done now in my late 30s is say no. I finally listened to Steve Jobs. I don't know if you guys can see that little boat thing in the background, but it's a shrine to Steve Jobs. You can probably zoom in and you'll see all of Steve Jobs's books that are on there. He said the greatest thing to do is just to say no. Say 1,000 no's and 2 yeses, and you will be the most successful person on the planet. And unfortunately, even if you've committed, you have to be genuine and honest with yourself first to make sure, hey, can I really take on these 7 things? And I want to be very honest with you guys, nobody can take on 7 things. You can commit to 7 things, but you've got to prioritize it and say, these 4 things, I either need to set expectations if I can, and say, speak with the owners and say, can I get to this next week? Like, you've got to set expectations. If you cannot set expectations that they're not being flexible, you somehow have to say no. I don't know what the situations are, Tiffany, in terms of if you can say no, but you've got to be honest and set expectations with the very people, communication with the people that are in charge, to kind of set those boundaries. And I will urge you to say, before you accept any opportunity, regardless of how good it is, you sit and think about it. And it's hard to say no, but for yourself and your mental health and your ability to focus and do great work, you've got to say no to many other things.
It's a great answer. Thank you. Our next question is from Kelly, who's asking, besides your experiences, what do you do to stay marketable for whatever may come next?
That's a good question. So I would say I always tell people, because staff members, whenever they have the opportunity to kind of get into our all staff meetings every month that I have with them, that's their opportunity to ask me real questions, just straight up ask me questions. And they always ask, there's always somebody that says, hey, I want to become a manager. How do I do that? And my first thing to them is, which would be 8 steps above what they are today. My first thing would be to anybody is to crush it at what you're currently doing today. When I started at Emory as a manager, I was straight out of UGA, and I had the biggest ego, and it sat right here. And I was like, I'm going to be a manager, at 23, and I'm going to be a senior manager at 24. I'm going to be a director at 25. And thinking about that roadmap it distracted me from my current job and what I need to actually do with my current job to make it the best thing I ever do. So I think what you need to focus on first is not what you can be doing, but to focus on what you're doing today, crush it, and then you'll have something to say about it. And that's what you're able to use to be marketable. So in other words, I am hell-bent focused on my job, hopefully making people happy in their jobs and all those types of things. And once the metrics come out and they look great, that's when I become marketable. But to be able to get there, you've got to be very narrow-minded in a sense to focus on what your current role is, do really great at it, and that's going to help you propel into the next role. And just so you know, whenever you have a goal, I had goals back in the day. I was like, oh, I want to be a chief of operations of a hospital by this age. And I want you guys to know things change. In general, things change. And if you focus on what you're doing today in your job and you do a really great job at it, something opens up that you never would have expected that you were going to do. I never thought I was going to be in a business office for a massive healthcare system. It sounds really bad, but I love the financials part of healthcare. I love it. And I never knew I would be here. And if I had set goals, I would have never ended up here and I would have never probably been happy. That's kind of dark, but I would say my takeaway is crush it at what you're doing today and you'll have a lot to tell when you have successful stories on what you did today that was successful.
That's some good advice and I'm definitely taking to heart. Our next set of questions all kind of have a common theme of managing relationships. So I'll try to group these in the best way I can. So first question, how has COVID impacted your approach to managing relationships? I know that's changed a lot. I mean, we've been on Zoom for going on a year now. So what does that look like for you?
Yeah, it's a good question. It's interesting. We call it in our team, and maybe people call it that outside, I don't know, COVID fatigue. And it's because as we're going from we use Microsoft Teams, same thing as Zoom. But when you go from meeting to meeting, now that we're in the virtual environment, it's now back to back. You barely have those breaks to, go out to somebody's office and just ask a question, for example. You can't do that, right? Because we're all working virtually and you're so back to back that the relationship piece is challenging because typically you just go into somebody's office, say, hey, can I close the door? I got to talk to you about something transparently. Those types of things. You can't really have those closed door conversations to help build relationships and calm conflict management. So conflict management became a real situation in the virtual environment because now how do you handle conflict if you can't even see the person, see how they're reacting? Because typically you're picking up the phone and you're chatting with them and you can't gauge emotion. So you almost have to become hypersensitive around how that looks. So I think I don't have a solution for it because we have to get used to it, right? We're going to be working virtually indefinitely. I know my entire team is. And so we just have to get better at it. So what that meant was I started opening up and being more visible and transparent. So every single week I send a recap email to my staff to address anything. There's a lot going on in the country, nationally. And so I've taken the time to actually use my weekly recaps to talk about that. I think we would be remiss if we didn't acknowledge the things happening in people's lives that matter to them and don't bring it up at work. So I use my Friday mornings at 4 a.m. weekly recaps to them to address social issues, national issues that might be impacting their thoughts and their minds at work because their work is right in that living room that they're watching TV. And so I think acknowledging the mental health aspect has really helped people to feel comfortable, to get used to the phone environment and the virtual environment and those types of things. And I also give them mental health check days or hours if, they're hourly, a lot of our frontline staff, except for the leadership team. So, taking an hour can sometimes be a lot for them. So we give them a mental health check hour, for example, or two, or a day if they need. And those are things that WellStar offers. But I say it's most important to get in this environment because it's created distance virtually, to get personal with people and let them know that you are available to them, and that they should feel comfortable to come to you now. And it has really helped in that sense, getting a little more personal with people.
Thank you. Again, still sticking with that theme of relationships, what is some of the best advice that you have cultivated being a UGA student for developing relationships in college, whether that's with professors, advisors, faculty, anyone?
Chris, sorry, can you say that one more time?
Yeah, no problem. My internet's being kind of spotty right now, so sorry if I'm cutting in and out. So the question is, what's your best advice for developing relationship management skills? I'm assuming that's with faculty, staff, professors, just anyone you'd interact with.
Yeah, good question. I learned very early on that I needed to ask for help. That was another confidence thing and ego thing that I had was, I'm not going to go ask the professor after class because I want to go hang out with Luke downstairs, play some PlayStation. But what I figured was I need to, if I need help, or if I want to build a relationship with my professor, which I need to do, that's very important. That's why I told you guys and harped on my relationship with my advisor at the time in Franklin, because that not only did my advisor help me in my career path, but also just talking through things. So I think you need to take this step, and that's with any role. I'm saying this now at 36 years old, that you have to take the initiative to go speak to people and go talk to people and be vulnerable. So I made the initiative to go talk to my professors, ask them questions, get to know them. And that should be across the board, faculty, advisors, anybody. I think that's absolutely crucial. And it's very important to not just to socialize with them and get to know them and get advice and things like that, but also you need a coach. Everybody needs a coach and a mentor. In some cases, it might be two different people, but I think it's important. It's helped me out. And I don't think people say that there's a connection there to mental health, but I think it is, even if it's a professional development coach. There's still a mental health component to that, because you're actually vocalizing your feelings, your true feelings of how you feel about your current job, how things are going with your family, things like that. Those are things you talk to your coach and your mentor about. And those have been the most important relationships that I've had that have helped me to grow in my career. And I've realized through that mental health as a whole has been a big deal as well. So I just highly urge you guys, not only get to know your faculty and your advisors and get out there to meet people and get advice, but actually have a mentor or a coach, somebody you can text or call and on a recurring basis get to know, because that relationship is going to be key.
Awesome. Our next question is from Emma Rose. She's wondering about career paths with an MPH. So she's considering perhaps healthcare lobbying. And do you know anything about that, what you can do with an MPH?
Yeah, that's a great question. I love healthcare lobbying. I work very closely with our government affairs team. I've helped to write letters with them that would go direct to members of Congress, including our state legislators as well as national. And a great way to really understand if you like healthcare lobbying is to make sure you're a part of the AHA.org, the hospital associations, including the Georgia Hospital Association. Get to know those people. They're fantastic. And I'm more than happy to connect anybody with any one of those leaders. I totally forgot what the question was. Was it what I know about it? Sorry, Chris.
Yeah.
Yeah. So That's a great question, and it's actually the reason why I didn't get much sleep last night, and it's because any law that comes down related to healthcare, and whether it's from the state, so a Georgia law, as an example, for surprise billing, and you can Google Georgia surprise billing, came about and was signed by Governor Kemp in July 2020, and it went into effect on January 1st. But the insurance commissioner's office has not prepared us yet with many aspects of that law that we were ready for, that we were working for months to work on with our EMR and all those different things. And the whole point of surprise billing, that Georgia law, was to make sure that if a patient came into a healthcare facility, that they didn't end up with an out-of-network bill, which is called a surprise bill. That's why the law is called a surprise billing bill. And for example, patient goes into a WellStar facility like Kennestone. Aetna told them that they can go into Kennestone's hospital. That's great. They went in, but the anesthesiologist that saw them, because they went under, was actually contracted by Kennestone. And so that anesthesia bill is actually out of network and will end up being a huge bill for the patient. And that would be a surprise bill. So today the patients are paying out of pocket for that. And so Governor Kemp and Georgia legislators said, no more surprise billing. Hospitals, go figure it out. That's where healthcare lobbying comes about. Healthcare lobbying helps to make sure that the hospitals are protected and the healthcare systems are protected in the sense that we're able to even make this law happen. There are a lot of legislators who don't know about healthcare and who make the healthcare rules. And so that's why we need healthcare lobbying. And it's because they're the ones giving the message from WellStar's CEO, Candace Saunders, to say, here are the 4 things we cannot do from that law. Please work to amend it so that we can actually get this rolled out for our patients to not be impacted. So healthcare lobbying is absolutely fantastic. I say you absolutely need to be part of those distributions and subscriptions to AHA.org, GHA.org. Get to know your local community in relations to lobbying. It's really huge. I love it. I love being part of it. And it's really exciting, especially now when everything you hear about are state legislators and elections and all these types of things. You really feel like you're a part of, a big national movement. So healthcare lobbying is big, and it's going to be even bigger under the new administration. Who knows what is going to be happening with healthcare under our new administration? So,
I would love to get your email if that's possible.
My email is lukemassey@gmail.com. I'm just kidding. I'm sure that
I'm sure
Debbie, are you going to send it out to the group or? Okay. All right.
Thank you so much.
Yeah, of course.
We'll definitely share your contact if that's okay with you. Thank
Absolutely. Absolutely.
Did you want us to share your Gmail address that we've been using?
Yeah, Gmail 12. Thank you.
Yeah. Okay, awesome.
So that's all the questions in the chat so far. I've got one for you though. It's kind of like a big picture question, just about your career in general. So what do you find most rewarding and most frustrating about careers in public health?
Most rewarding and most challenging or frustrating. So the thing about that question is, in public health, it could be it's such a broad spectrum. I am on the healthcare administration part, and I'd call it health policy. I think to Emma's point, health policy is a massive part of what we do in healthcare administration. So I would say, Chris, can I specify to healthcare administration?
Yeah, sure.
Okay, thanks, because that's what I can speak to. I can speak to some parts of the MPH. So I have had several people reach out to say they've gone into a career in policy, like for example, CDC is a great example. It's like a normal track for somebody to go to get an MPH, to go to an MPH program, get an MPH, and then go to the CDC. Then they realize that they want to get more involved in operations, and they realize maybe since I came from an MPH health, let me get into healthcare operations. And so I see a lot of transplants from the CDC portion of the MPHers wanting to move into healthcare operations, which is what I do, right? And so I would say the frustrating part about an MPH is that it's so broad, it's incredibly broad, and it's hard to know what exactly you want to do. And that's why I harped on just go out and do something. Like if you're in an MPH program today or in working to get into an MPH program, go volunteer at Athens Regional and see if you want to do healthcare operations, or go volunteer somewhere. It's hard now with the virtual environment. I don't know how it's working out in terms of internships and things like that. Emory just canceled their internship program for the summer. So I say that, and then there's a virtual environment impact. And I'm trying to work out a virtual internship for WellStar. So I'll hit you guys up when I get that done. But I think that's with any broad degree. You just don't have that specificity. So the only way you can actually know what you want to do, so you're not midlife thinking, shoot, I actually prefer operations, is you got to get into it. Got to get into it at some point. And the way to do that is to build connections. This is one way to build connections, is to get on these alumni calls. I think it's such a great idea, and kudos to Lindsay and Debbie and team, because it forces alumni to do their due diligence of paying it forward back to the people that very much made us into our careers. So I think it's very important to get yourself out there. Emma just is going to email me about government affairs. She has no clue if she's going to like it. It sounds great, but she has no clue if she's going to like it unless I, connect her with a couple people and she starts talking to them and realizes she wants to go into law. Who knows? Might be too late, Emma. I'm kidding. So anyway, that's the frustrating piece to me is, it kills me when people reach out to me and there's a pivot in their career. I love it because you've come to the realization, but it makes me want to pay it forward to you guys to let you know, try as much as you can to expose yourself to options, because you really want to try and figure out what you like and what you don't as quickly as you can. It's okay if it happens midlife. That's totally fine too. The most rewarding piece is the satisfaction of, and I'm talking from the healthcare administration side, of problems being solved. And the problem could be a financial problem. It could be an employee satisfaction problem. It could be any one of those things. And it's what we're trained to do. We're trained to solve problems, right? So I think the problem solving part is what keeps me going in my role, and it definitely rewards me.
If there are any more questions, feel free to drop them in the chat. I know Miss Debbie always has one she saves for last for our guests on here. So unless there are any more, maybe Miss Debbie can take it away.
Okay, I do not. I will pass the torch to Miss Tiffany.
Hi, everyone. That was great, Mr. Gobin. We really just appreciate you coming and sharing with us today. And just taking out your time. We know you're busy, especially just given this period. So just thank you so much for sharing with us and being here. And thank you everyone for listening in and being interested. And we hope to continue providing great guest speakers for you guys to come in and listen to. I definitely learned a lot, and that I plan to carry on with me for the rest of this year and hopefully the rest of my career. Something that I really took from this entire discussion was focusing on not what you should be doing, but what you are doing today. So being narrow-minded. So thank you for also instilling that in me. So please feel free, everyone, to join us for our next Franklin Connection, connecting with students with alumni on Wednesday, February 10th at 4 p.m. Our special guest this time will be Whitney Ingram. Whitney works at the Sandia National Laboratories in Albuquerque, New Mexico. In 2019, she was the first African-American to receive a PhD from the University of Georgia. So if you're interested in that, I think it's a great opportunity to connect. Definitely come out, and that's February 10th at 4 p.m. Thank you, everyone, for coming. Thank you, Mr. Gobin.
Appreciate the opportunity. Thanks so much. And nobody call me Mr. Gobin. Just call me Adam.
Sorry.
So, thank you all. Have a great day.
Thank you.
Thank you so much, Adam.
Of course, anytime. Take care.
Bye, Adam.
Thanks, Adam.
So good to see you.